Hello everyone, this is your nursing student Brian, and for today's video, we are going to perform bed bathing. We all know that bed bathing is a thorough wash given to a patient who can't leave the bed. There are two different types of bed bathing, the partial and the complete bed bathing. Okay, so one of its purpose is to remove temporary microorganisms, body secretion and excretion, and the dead skin cells. Also, to stimulate the circulations to the skin, to promote a sense of well-being, to produce relaxation and comfort to our client, to prevent and eliminate unpleasant body odor. So equipments needed, we only need a basin with warm water, a soap, if it is needed, linens, clean gloves, hygiene materials, which is alcohol, shaving equipments if it is needed, a table for the equipment, and a laundry bag for the dirty linens. Alright, before performing bed bathing, we need first to assess our client on his physical or emotional factors. For example, our client has this trauma, the skin color. If our client is experiencing cyanosis, jaundice, and pallor, we need to observe that, examine that in our client's body, skin, the pain, range of motion, mobility, strength, and also the cognition. We need to consider those factors. Factors before performing bed bathing. Before proceeding to the next procedure, we need first to perform how to make a bath mitt. Of course, we have here a towel. So we are going to make a bath mitt. First thing we need to do, we need to lay your hands on the wash clothes and fold one side over your hands. Something this one. Then, we need to fold the second one, okay, over your hand. Then, fold the top of the cloth. Then clip. Okay, everything's done. We already have our bath mitt. Prior to performing the procedure, we need first to introduce ourselves to our client. Okay, we also need to identify the identity of our client. Hi, hello sir, good afternoon. I am your nursing student, Brian. May I know your name, please?
Hello, good afternoon. My name is Jerry.
Your birthday?
April 6, 2001.
Okay. Then, you need to explain the purpose and why is it necessary, okay? I'm going to perform bed bathing, sir. Is it okay?
Yes, it is okay.
One of its purpose is to remove and to make your body comfortable, okay? Remove the bacteria and make your body more comfortable. Alright. So, after that, we need to perform hand hygiene. Okay? This is to prevent ourselves from the transmission of bacteria. By the way, we are using antiseptic solution, disinfectant solution, alcohol. Okay? Next, we need to provide client's privacy by closing all the window, having curtains, closing the door, everything should be need to provide client's privacy. Okay? Next procedure, we need to remove the top sheets and the upper clothes of our client. We need to place the bath blanket over the top sheets. Therefore, we are going to remove the top sheets. Sir, is it okay to remove these top sheets?
Yes.
Okay, I am going to change bath blanket, sir. After this one, we are going to remove the upper clothes of our client. But as you can observe, I've already removed the upper clothes of my client and put it on the linen hamper. Alright. So after that one, we need to put the top sheets on the linen hamper. Okay, next procedure we need to wash the face of our client. We need to place the towel under the head, wash the eyes, ask if the client wants soap. Sir, do you want soap?
No, sir.
So, wash, rinse, and dry the face, ears, and the neck. We have here the initial warm water and the final warm water. After that, we need to remove the towel and then put it on the warm water again. Next procedure, we need to wash the arms and the hands of our client. In washing the arms and hands of our client, we need to place the towel lengthwise under the arm. Wash, rinse, and dry the arm. We need to apply deodorant if it is the desire of our patient or client. We need also to soak the hands in the basin if it is also desire of our client. So as what I have said earlier, we are going to clean the hands of our patient. After that, we need to wash the chest and the abdomen. In washing the chest and the abdomen, we need to place the towel, same process, lengthwise over the chest. Wash and rinse and then dry the chest and the abdomen. We need to wash, rinse. Alright, we're going to clean the abdomen of the chest and the abdomen of our client. The chest over here in the thorax and the abdomen up to the abdominopelvic. After that, remove the towel and switch the patient to a prone position. You need to ask your patient to perform to the next position, which is the prone position. Sir, is it okay to move backward? So, we are going to clean the back and the perineum. Alright. We have here our initial warm water. In washing the back and the perineum, we need to assess, okay, the client into prone or side lying position. It's already done. Then we need to place the towel lengthwise along the back and the buttock. Wash and dry the client's back. Then assess your client or patient to a supine position. Sir, same position. After that one, we need to wash the legs and the feet of our client. In cleaning or washing the legs and the feet of our client, we need to expose the farthest leg. After exposing the farthest leg of our patient, we need to lift the leg and place the bath towel lengthwise. We're going to start cleaning or washing the leg of our patient. After that, you need to cover the leg and you need to cover the leg to provide privacy of our client. Place the feet in the basin with water if it is the desire of our client. Then dry each foot. Next procedure, we are going to perform or wash the perineal in additional care of our client or patient. We are going to assess its perineal part or the private part of our patient's body. However, we are not going to perform perineal care. We are not going to touch or whatever the private parts of our client. So now we are going to use or repeat the process or the procedure by using the final warm water. As you can see here, we have here the initial and the final warm water. We will repeat from the very first. by using this final warm water. From the very basic, of course, we need to wash the face. From the eyes, okay, neck, ears, okay, and the nose. Next, we need to clean the arm and the hands. Next, we are going to clean the chest and the abdomen. Then, wash the legs and the feet. Assist your client in a supine position. To assist our clients to put his upper clothes. Okay. But of course, we need still to maintain the privacy of our client. We have it here, our upper clothes. Then, we are going to provide the blanket or change the bath blanket by the new top blanket. Sir, I'm going to remove this one. And we are going to put this one in the linen hamper. That's all in performing or the procedure of bed bathing. I am surely our client is 100% safe from any bacteria, viruses, or any microorganisms. I know that my patient or client is now comfortable and safe.